How to remember all this? The rule is very simple, guys. It is only the aortic area which is on the right side. Everything else is on the left side. Simple. And on the left side, from top to bottom, we can make a list, right? So starting with the first intercostal space, we have Gibson's area, which is the area for PDA murmur. Second intercostal space is the pulmonic area. Then third intercostal space is the neo-aortic area. And then remaining lower sternal border is tricuspid area. And the location of apex is your mitral area.